All right. Then I'll begin. Lakeville affirms in our first contention is preventative care. U.S. preventative care is terrible. With Layman 18 findings, survey data found only 8% were getting recommended preventative services, including screening for cancers, counseling on obesity, and vaccinations. This is because private insurers rely on short-term profits, with Levi 19 explaining underutilization of preventative services is a result of an implementation gap rather than an information gap. Financial incentives do not align with a focus on preventing chronic diseases. Providers are paid to treat rather than to prevent disease. The AF solves as Tannenbaum 19 explains, only governments have the wherewithal to invest in people as productive and tax-paying members of society over their lifetimes. Medicare for All may be the only solution for the short-termism of employer-based healthcare. The impact is health, with Kelling 16 predicting 100,000 lives could be saved each year with widespread adoption of preventative healthcare. Our second contention is global access. Prices in the developing world are kept extremely high, with Neville 19 finding the world's poorest countries are paying the highest drug prices, with everyday medicines costing up to 30 times more than in rich nations. Markets tend to be dominated by a single supplier, directly affecting the prices paid by public bodies or consumers. Medicare for All would solve in two ways, and the first is reimportation. Fears of drug importation keep prices high in the developing world, with Commander 11 finding manufacturers are reluctant to lower prices in less developed countries because those products can be resold to more developed countries where they were manufactured, undercutting the prices charged there. Medicare for All solves by decreasing drug prices here in the United States, taking out any need to import drugs, and thus allowing companies to lower prices. As CATS 19 finds, patients in the United States pay the highest prices in the world for prescription drugs. A Medicare for All system would have more leverage with the drug industry and would reduce drug spending by a third. This is crucial, as the threat of reimportation is the primary reason for high prices in the developing world, with Danzanon 03 concluding, manufacturers' ability to maintain price differentials is the single most important obstacle to lower prices in low-income countries. Second, evergreening. Currently, drug companies hold on to monopolies around the world by renewing use of drugs. As Narayana 19 explains, 90% of new drugs provide few or no clinical advantages. A technique known as evergreening is when drug companies produce minor modifications of old drugs. By making slight alterations, companies continue to hold patents for drugs to prevent competitors from selling generic versions. Medicare for All solves by refusing to pay for replicated drugs. As Narayanan continues, if a new drug had more benefits than an older version, the government would pay more for it. If a new drug produced the same results, the government wouldn't pay more for the new drug. So Medicare for All would encourage pharmaceutical companies to pursue truly innovative drugs because such drugs would be more profitable instead of producing redundant medications. A lack of generics make prices impossible for the developing world where patent regulations are less stringent, with Grant 19 finding a robust market for generic drugs is a core part of an affordable health system. There is little competition in the supply of essential medicines in low-income countries. The largest seller can account for upwards of 85% of all sales. The impact is mortality, with RCP in 2019 finding 2 billion people worldwide have no access to essential medicines and vaccines. The death toll is estimated at 10 million people a year. Our third contention is a factory farm pandemic. The next great pandemic will emerge from U.S. poultry farms, with Heidi 20 writing, factory farms are the perfect breeding grounds for disease. These operations house tens of thousands of animals in overcrowded, poorly ventilated, and unsanitary conditions. Strains of bird flu that have infected people have already resulted in a mortality rate as high as 60%. The World Health Organization has said that a future pandemic from the bird flu is a certainty. Medicare for All would lead to a stronger response to new diseases by centralizing healthcare, with Zimmer 20 finding Medicare for All would implement a standard billing and payment system which would accelerate case reporting. Within a consolidated system, patterns in billing data can signal outbreak hotspots to public health officials. The single-payer system in Taiwan has facilitated exhaustive data collection and reporting. Taiwan empirically proves the system works, with Williams 20 finding the island has had just 7 coronavirus deaths. Taiwan had a universal healthcare system that keeps records on every resident to make tracing infections much easier. The impact is preventing another global pandemic, with Pamaro 20 predicting COVID-19 could push 100 million people into extreme poverty, with long-lasting impacts concentrated in countries that are already struggling with high poverty rates. Coronavirus is only the tip of the iceberg, with Mandel 20 predicting COVID could be considered a category 2 in the scale of pandemics and a more deadly pandemic, perhaps 100 times worse when it comes to produce a fatality rate of 1 in 2. Thus we affirm.
Okay, can we see the Neville evidence?
Yeah.
Can we see Danzon?
Okay.
And then Graham.
Grant?
Sure. Yeah, I think it's Grant or Graham. One of the two.
Are you talking about just to clarify, the one that says 85% of like the market is one?
Yeah, that one.
Okay. Okay, I sent all 3 cards.
Oh, you sent all 3? Okay. Is it okay if I just look at them during Arjun's case?
That's fine.
Sounds good. Hey, I still haven't gotten them, so I guess one sec.
Did you get my first email?
Yeah, I have like
Okay,
the first blank email. It's just the second one
got
hasn't
it.
gotten. Okay, we just got it. Urgent. Is everyone good for case? Okay. Rhina 98. Contention 1 is Afghanistan. Currently, Imzadi 16 for the diplomat writes that the Afghani government has succeeded in succeeding and signing peace deal, representing a major breakthrough for Afghan stability. Gibbons Neff 20 for the New York Times confirms that the U.S. is planning on pulling more troops out of Afghanistan to accelerate the peace process in the country. Unfortunately, America passing Medicare for All would derail the current peace process by collapsing Afghanistan's economy. The UN Office of Drugs and Crime 18 reports that due to record high production of opioids, Afghanistan's economy now depends on the cultivation of opioids, accounting for 32% of total GDP. America is key to keeping this industry afloat. As Levine 17 for the AAP explains that after Afghanistan became a major supplier of opium, they've depended on the US market, as 80% of the world's opioids are sold in the US. Medicare for All would collapse its market by reducing the sale of opioids in the U.S. As Monkey 17 for the Hill writes that poor health drives demand for prescription opioid medications, so increasing access to preventative care through Medicare for All would stop people from turning to opioids in the first place. Moreover, Lopez 17 for Vox reports that in the U.S. there are hundreds of opioids alternatives out of reach, but that they're out of reach for Americans, concluding that solving the lack of insurance for Americans would prevent these individuals from purchasing opioids. Unfortunately, Bird 16 for Harvard University confirms that due to Afghanistan's weak economy, reducing opium sales would damage the economy in many rural hospitals, leading to more support for Taliban to take over after desperation and anti-American sentiment to take over the country. Allowing the Taliban to win allows them to continue the war. Problematically, the Watson Institute 20 reports that nearly 150,000 people have been killed by the war in Afghanistan. Unfortunately, Taliban victory would also spill over to Pakistan and cause instability. Palawal 19 for the University of London explains that increased Taliban influence in Afghanistan would lead to more Pakistani-influenced extremists to rise in terror in India because there is institutional backing from a terrorist group. Indeed, Kenny 16 for the Australian Defence College finds that the success and strong influence of the Taliban in Afghanistan would embolden anti-state actors in Pakistan, leading to the state failure of Pakistan. Critically, O'Hanlon 5 for the Princeton University writes that should Pakistan collapse, nuclear weapons would be in the hands of extremists, making nuclear conflict between India and Pakistan extremely likely, as Pakistani rogue actors would be fire against India and India would be required to respond. The nuclear conflict would be the end of humanity, as Tretvik 19 for the Drive concludes that even a limited nuclear exchange between the two could lead to the health and climatic issues on a global scale, creating a nuclear winter which would cause human extinction. Contention 2 is the stock market. After 8 months of the coronavirus, Wolf 24 538 writes that the economy is on the rebound, with unemployment falling below 10% for the first time since March. Unfortunately, White 20 for NBC News finds that even though the U.S. is slowly moving towards a recovery, a second shock would easily push the economy into depression. As a result, staying on our current path is key to sustain our fragile economic recovery. Unfortunately, Medicare for All would redirect us towards economic disaster by eliminating private insurance. Abelson 19 for the New York Times finds that Medicare for All would abolish the private insurance industry by replacing it with a government-run system, concluding that the move would decimate the healthcare sector, which makes up 20% of the entire U.S. economy. Abelson furthers that the bill would not give compensation to the millions invested in private insurance companies whose stocks would become worthless overnight after Medicare for All would pass, leading to extreme capital flight and industry collapse. Indeed, Epstein 19 for the Hoover Institute explains that banning all private health insurance through Medicare for All would drain trillions of dollars from the stock market, resulting in havoc in the economy. The impact is economic collapse. Howard 17 for Fulcrum Strategies writes that if the healthcare industry collapses, the economic effects would make the 2008 housing crisis seem minor in comparison. Problematically, Bradford 13 for the Huffington Post concludes that the next adverse economic shock, like the 2008 housing bubble, would push 900 million people into poverty. Thus we negate.
We'll take. Can we see the weak economy allows Taliban to take over?
Yeah.
Also, can we see that 80% of opioids is sold in the U.S.?
Yep. Okay, both are sent on the email chain.
All right. We'll run prep. I don't have. I haven't gotten it yet.
Just start prep whenever you get it.
Yep. Sounds good. All right, we got it. I'll run prep. All right, that was 40. We can do cross.
Okay, go ahead with the first question.
Okay. So you say with stocks that like Medicare for all would abolish the private industry, which would push 900 million people into poverty. So why would the
Yep.
bill provide no compensation to investors?
So the bill just doesn't have a provision in it to provide compensation to investors, but more importantly, it's like a perceptual link, right? Like the Abelson and Epstein evidence make it very clear. Like for example, we have a different piece of evidence like from the week that says that just when Democratic candidates started talking about Medicare for all, immediately like investors started fleeing and like the stock started getting impacted. So like there's empirics on it too. Let's talk about your second contention about access. The first piece of evidence that you read in this says that developing countries pay the highest prices, but then in your first one about reimportation, you say that American prices are higher. Which is it?
Well, the argument is that overall the developing world pays more than developed countries as a whole, which includes countries like Europe. So like the US can be the highest, but on average the developing world still pays more.
Sure. So then why is reimportation a fear?
Because reimportation is a fear because it's the commander evidence, right? So if they sell drugs at a low price in the developing world, then they can get resold to the United States for cheaper, which like undercuts the profit.
Right, but the Neville evidence that's at the top of your case is that these countries pay more than the United States.
Yeah, that's the point. They pay more in the status quo. They can't lower the prices because of the risk of reimportation.
Okay, like but reimportation is only an issue. Like the internal behind reimportation, though, is that they're fearing that they're going to be undercut once people reimport them back into the right. So that relies on the logic that it's paid that like the people who are like on the black market are paying for it cheaper in the developing world.
Reimportation doesn't happen in the status quo. That's the point because we don't have Medicare for all. Like because they're selling at high prices in the developing world now. That's the argument. Like they're selling at high prices because reimportation could happen if they lowered prices. Huh?
What are you changing then?
The threat of reimportation goes away.
But you're saying that it's high right now. So then why is there a fear of that right now? You're saying that
there's a fear of reimportation because prices are high. Okay, prices are high because there's a fear of reimportation. If they lowered prices, then they would get sold to the U.S. undercutting because we have really high drug prices. If we lower drug prices in the United States, the fear of reimportation doesn't exist anymore, so they can lower prices in the developing world. Can I have a question?
To clarify, you're saying that the price, in order for reimportation to not be an issue, the price needs to be the same in both markets.
Price needs, it doesn't need, what? I mean, like, if there's like a minor price differential, that probably doesn't matter because there's like still shipping costs and stuff, but like overall the prices.
Like minor, but like overall,
Okay, so on your first argument about Afghanistan, you say that like the terrorists would get access to nukes, right?
Yeah.
So like, why wouldn't the U.S. military launch an intervention to get a hold of the nukes?
I mean, I'd say that just emboldened the Taliban even more. That's like an independent.
But if we get access to the nukes, why does it matter?
Well, first of all, we don't know where Pakistani nukes are hidden. Like, if we did, then we would have done something about it.
I mean, if we like take control of the country, then like no one can get access to the nukes anyway.
How is that going to happen if we just removed all of our troops from Afghanistan, which is what our uniqueness is?
Because we'll put them back in.
Like, how long will that take? Like, the Taliban will have control over that way before the U.S. intervention.
That's time. We'll run prep. Stop prep. That's around 2:30 total. So we got 30 seconds or 1:30, I guess, if we're on 4 minutes prep.
It's just going to be down the neg. Okay. Let's start on their Afghanistan argument. First off, their link is all about opioids. If opioids don't go down under Medicare for all, then they don't have access to their impacts. Universal coverage doesn't help stop opioids. As Humphrey 19 finds that Vancouver provides universal insurance and has much less economic inequality, yet has nearly identical rates of overdose deaths as West Virginia. That's because they don't address the root causes. As Das Gupta 18 finds, researchers agree that factors such as opportunities, working conditions, and hopelessness are the root cause of the misuse of opioids. Second, they have no evidence that says that most of the U.S. purchases of opioids come from Afghanistan. We would say that most of them don't. Many of them come from Myanmar, but for the most part, they are coming from the growing fentanyl markets coming from China and Mexico. We can make them synthetically, which is why we don't need the poppy plants in Afghanistan. Third off, the Afghanistan Taliban and all these terrorist groups can always just diversify into mining or other drug markets. If we aren't purchasing opioids, they can always just try and sell opioids to other developing countries. There's nothing unique about how much money they're going to be losing from these opioid markets. On their Taliban link specifically, first, their link is that the Afghan economy will be damaged, which means that recession links in just as well. That's why you can turn it, as cutting out household costs would save the economy, as Lopez 17 finds. Our healthcare system is causing damage to the economy. We can handle rising costs with good policy or do nothing, which would result in more rising costs and ultimately recession, as household resources go towards medicine instead of homes or clothes. We are headed to the biggest recession ever, and if we don't implement Medicare for all, then that triggers their war scenario. Second, pandemics also spread to Afghanistan, which increases the likelihood of wars that they talk about because these terrorist leaders need somebody to blame, and people are going into poverty, which increases the terrorist people's power. Third, their evidence doesn't say that the Taliban would rise or overthrow the government. It just says that they would get more support. Just because they have more support doesn't mean they overthrow the government. But fourth, the U.S. would fill in if the Taliban started to rise, stopping them in their tracks, just like we did with ISIS. Then they'll just, like when ISIS tried to rise again. The U.S. can also invade Pakistan or Afghanistan to get control of their nukes before they can actually fire them. That's the cyber operations capabilities that we've had, and we have troops in the Indian Ocean and stuff that we can infiltrate and make sure that they do that before deterrence puts in. Also, we outweigh on probability because because Pakistan didn't start war with India before, and also Pakistan and India had a war in the 20th century. They did not use nukes. It is the only instance when two nuclear powers had a war against each other and no nukes were used. When nuclear war is highly unlikely due to mutually assured destruction, no one wants to use nukes because it would destroy everyone's populations. High magnitude but low probability impacts are extremely bad because it would cause policy paralysis. If every argument can find a link into nuclear war, like our pandemics arguments could enrage Kim Jong-un, which could fire a nuke at Japan, then that just means that every argument has some tiny chance at nuclear war, which means that no policies would ever be passed, which is bad. Go to the stocks arguments. First off, companies would be fine. Katz 19 finds that health insurance companies which have additional lines of business would survive. Second, Medicare for all has 4 years to be implemented, which means the companies can diversify in the meantime. Silverstein et al. 11, health plans push businesses to international markets, health IT, and holistic health innovation strategies. Third, you can turn it as diversification actually increases company value. Reddy et al. 19, investors view growth into new sectors as a way to increase higher access revenue streams. Value increases in the long term. Fourth, in the short term, high stocks will prevent coronavirus stimulus. Ponsec 20 finds that market buoyancy will undo the urgency for more economic stimulus. If the market stays up, chances of deals in Congress this year are likely to approach zero. Stimulus is needed to prevent this recession from getting any worse. As Longcoast 20 finds, the best tool to prevent a downturn is another stimulus package. Concern about a backslide is getting more serious every day. Unemployment claims have climbed and spending has retreated. That means that their argument is not unique. We're headed to a downslide already, but also it means that we solve. Prefer you because you know that the current recession has lifted tens of millions of people out of poverty, meaning that's more probable. You know that pandemics cause recessions, which is always so why our fourth contention links in. And also, the stock market doing well empirically doesn't help consumers, as unemployment is rising right now with a booming market, which clearly means that the stock market doesn't have high correlation to the economic growth of the United States.
Yeah, so we're gonna need some evidence. Can we see Humphrey, Lopez, Silverstein? Yeah.
Wait 1 sec. I think I got all of those, but you might have to repeat them to me.
No worries.
Yeah.
If we don't get them, then we'll get them later, I guess.
Okay, so I'm going to start at the top. You wanted Humphrey?
Yep.
Okay,
And then
that's there.
Lopez.
Lopez and Silverstein, right?
Correct.
Okay.
Oh, actually, can we also see the first response that you read to stock market? Whatever covers other lines of funding.
Yeah, yeah,
Thank you, Henry.
cool.
We'll just start prep when we get them.
I sent it.
Okay, so I think I just got it. It just said one new meet. Oh, yeah. Never mind. Yeah, we just got it starting now. Actually, pause prep. That's 30 seconds. Did you read a card for your like diversification turn?
Yeah, there's cards for
Yeah, I did.
diversification.
Oh yeah, it's ready. Could you send that?
Yeah,
Yeah.
sounds good.
It's sent.
$230. It's gonna be frontlining C1, frontlining C2, weighing their case. Oh god, my shoulder.
One sec. What is? That was an extra 15. Sorry.
Okay, so yeah, same order.
Oh wait, what is that overview?
It's fine. Okay, is everybody ready? Starting our first contention about Afghanistan, they try to read a economic growth link in and read this Lopez evidence that says economic growth spills over to Afghanistan. Two responses here. Number one is Fishbot 19 explains that Medicare for all will require increasing taxes with at least 2/3 of Americans with less money overall, which means the economy doesn't grow. But number two, if we win any link into econ decline, it means that we also have an internal link into any nuclear conflict scenario. Go to our first contention about the stock market. They read 5 responses. First, they say that healthcare facilities have other sources of funding. 2 problems here. Number one, our argument is that they literally abolished the industry. It doesn't exist anymore. Number two, even if they are diversing to other types of funding, it's 20% of the GDP that gets wiped out after Medicare for all. Their second argument is that it takes 4 years to actually implement. The big problem is that investors are going to pull out on day one if they know that in 4 years their investment is literally going to be worthless, which means that they literally are going to happen on day one right after you pass Medicare for all. It doesn't matter whether there's a transition period. But the third argument is that investors are going to diversify. 2 problems here. Number one is our Abelson evidence explains that investors are not compensated under Medicare for all, which meaning that they can't diversify. Number two, under COVID-19, they're already uncertain in the stock market, which means that if they get money back, they're never going to reinvest it in the rest of the stock market. On their fourth turn, they say that it prevents a COVID-19 response to stimulus. 2 problems here. Number one, our recession is uniquely worse because the Howringer evidence at the bottom of our case does a unique comparative analysis that explains that our recession is even worse than the 2008 recession, which COVID-19 is not worse than, which means that our recession is always going to be worse, which means that we still have a unique impact. But number two, their impact is not unique. On the stimulus argument, Relentless 20 of MarketWatch explains that Congress is not going to pass a stimulus either way, which means that our offense is the only unique recession that happens in the round. Their last argument is that the stock market doesn't actually help the people, like the people in poverty. But sure, even if the stock market going up doesn't help people, when the stock market crashes, the overall economy crashes, and that hurts the poorest of the poor, which means we still haven't linked in. Our argument outweighs their case for 4 reasons. First is Bozzoli 14 explains that hospitals close during a recession, which means that preventative care never happens. Number two, companies don't sell to the developing world and do this reimportation like price gauging because they're in a recession. They don't change the policy. Number three, our new generics from their evergreening argument are never going to pop out during a recession because small companies aren't going to come up and build these generics because they're focusing on covering themselves from the recession. But fourth, our argument about recession outweighs their pandemics argument because during a recession, for example, recessions always make pandemics worse. For example, we wanted to open up the economy because we were in a recession, but it only made the pandemic worse. Go to the case. On their first contender about preventive care, 2 responses. Number one, it's literally one of our links, but number two, turn the argument. When 20 explains that we're already at full capacity in the status quo, which is why when you increase demand and increase coverage, it leads to wait times. The EUC 20 finds that 422,000 people are going to die from wait times, which outweighs their argument on scope. But then on their second contention about global access, as a general response, Commodore 11 explains that developing countries only pay 6% of US price. Prefer our argument because we have a warrant. Our warrant is that they have to adapt to the people that they're actually selling to. They have to sell at a lower price, which is why Lachawala explains that 200 million people have already been saved by U.S. pharmaceuticals. On their first warrant about reimportation, 2 problems here. Number one, Kyle 08 explains that analysis of 30 countries and 1,000 drugs finds that parallel trade has no impact on pricing. Number two, Medicare for all does not mean that decreasing prices in the U.S. leads to decreasing prices in the rest of the world. It's just decreasing prices in the United States. They have no link there. On their second argument about evergreen, 2 responses here. Number one, the WHO finds that the WHO has removed patent requirements to the developing world till 2023, which means that they can get access to generics from other countries in the status quo. But number two, Kim 20 explains that innovation in the status quo is really good right now. He explains that 41 new antibiotics are being developed in the status quo, which means that right now the evergreen process really isn't that bad. Biotech is still doing well. On the third contention about pandemics, 2 responses. Number one, it's a matter of management, not our system. Trump knew about the pandemic in January, but didn't close down the country because it's a matter of management. Taiwan had a different culture. They literally locked down the entire country. But second, turn the argument. Norquist 20 explains that not having single payer and regulations allows the U.S. to have a better response to the pandemic, which is why he concludes that we had more hospital beds than these other single-payer countries, but also he concludes that the U.S. is leading the one in vaccine research, which is why he concludes that we need to not have single-payer to allow us to respond better to future pandemics as well, which means we outweigh on time frame. They link into one pandemic, we link into infinite pandemics in the future.
Are you ready for cross?
Yes, sir. Henry, you can have the first question.
Yeah, okay. So you say that prices are only 6% in the developing world. Does this evidence account for all drugs?
What do you mean? What?
Like which drugs is this evidence analyzing?
What do you like? I'm pretty sure. Like, I can pull up the evidence right now.
Right, because we would say that, like, to say that all drugs, like, what is the comparisons from? Is it US prices to developing world prices? Because what I don't understand is if prices are so low in the developing world, why can't 2 billion people afford drugs?
I would say that either A, that means it's non-unique, they're selling at their lowest point in the status quo, and 2 billion people still can't access it, which means that neither of us have solvency. But number two, I would say that your argument doesn't really necessarily interact with our argument, that because we have a warrant on why, like, in the developing world they have to sell lower, while you're like Neville, I think, evidence, like, just it's very unclear. Can I ask you a question?
It isn't high. Yeah, sure.
Great. Okay, so let's talk about your actually, yeah, let's talk about your second argument about evergreening. Is it that, like, we promote more better innovation, or is it just that we remove companies' patents?
It's just that we don't buy Me Too drugs, basically. They're only used to extend patents.
Wait,
Can I ask a question?
Wait, so your link is removing patents, right?
The link isn't removing patents. It's removing Me Too drugs that are used to extend patents. Can I take a question?
Wait, how do you remove Me Too patents? Because it wasn't a case.
The government, the Narayanan evidence, like, explains it pretty clearly. The government just buy Me Too drugs. They buy the original drug. If they're already buying the original drug, there's no reason for them to buy the Me Too drug. Like, if a company makes like a drug and then they make the drug 2.0 that's almost exactly the same, the government's just going to be like, hey, no, we're just going to buy the original because we know what you're trying to do here, right?
Wait, so if they just buy the original drug, how does that link into global access for the drug?
Because it means that the companies have no incentives to create those Me Too drugs, which they also use to extend patents in the developing world. Can I ask a question?
Yeah, sure.
You say, is like the warrant in this fish bomb evidence your response to the Lopez turn that taxes will increase?
Yeah, it says taxes would increase under the bill. Can I ask you a question?
Why would the government increase taxes in the midst of a recession?
Well, the resolution is, should we pass the Medicare for All Act of 2019? It's the bill is funded by taxes, which is why the fish pot evidence explains.
Okay, does it say anywhere in the bill that it needs to be funded through taxes?
The funding mechanism in the bill is taxes. Can I ask you?
I want to see that part of the bill because I've been doing this topic for a while and I've yet to see the part of the bill that says it's funded through taxes. You can take a question.
Great. So let's talk about your patents thing. How do US companies not selling their like 2.0 drug mean that they can influence patents in the rest of the world?
It means that, like, if they made that drug, they would make no money on it in the US, which disincentivizes them from making the Me Too drugs overall, which means that patents can't be extended in the developing world.
Okay. Can we see the evidence that says decreasing prices in the US would mean that they can't get patents in the developing world?
I mean, yeah, we can send the Narayan evidence. Gus, I'll send it.
I'll take prep. Stop prep. Did you send
Yeah, I sent the evidence.
Okay. Let me know if you guys don't have it yet.
I think we might have had a misunderstanding. I just wanted the part that said Medicare for all wouldn't let them have patents in the developing world.
Well, the argument is that like they use the bad drugs to extend patents. Medicare for all wouldn't allow them to have the bad drugs.
Yeah, so can we see that bad drugs extend patents in the developing world then?
Like,
Yeah,
that
that's the first
specific
part of the
warranting.
like by making slight alterations, companies continue to hold patents for drugs.
Yeah, but that's about the US. I was talking about like them having patents in the developing world.
Okay,
Like-
well, it's not about the U.S. That's our evidence.
Okay.
All right. It's gonna start on our C1, address the turn, then go to our C3 way, which means I'll be addressing their weighing, and then I'll go to the neg and talk about that. Is everyone ready? Cool. On the turn on our C1, they say there's wait times. That's not true. Waldrop 19 finds that on average, socialized medicine have less wait times because there's less administrative work. But for us, because ours is an average, whereas theirs is just one specific like example. Go to contention 3 about factory farm. Extend the high D evidence, which says that factory farm pandemic is literally inevitable because of the unsanitary and unhealthy conditions there is. The Zimmer evidence says that Medicare for all would solve because it consolidates data, allows us to find hotspots and make better public health decisions. Williams says that there would be only 7 coronavirus, there's only 7 coronavirus in Taiwan because of the system. And the Parmaro evidence says that 100 million people will be pushed into poverty, like extreme poverty, because of the coronavirus pandemic. The next pandemic could be 100 times worse. Then on their responses, they say that like it's a management issue, like Trump didn't close it down. The first argument is that we have no idea who the next president is going to be when like the next pandemic comes. We would say that like you should prefer solving the root cause rather than like guessing who's going to be in the administration second. The argument isn't about the shutdown. It's about the researchers in the federal government who can like find hotspots and then distribute testing kits and like issue lockdown orders that are more specific to that region. That's why it's a lot better. Trump like isn't involved in that process because he's not a public health official. Then they say with the Norquist evidence that the U.S. is a better response because we have more beds. Just because we have more beds doesn't mean that our death rate is better. Obviously, the U.S. has performed much worse than socialized medicine country. The Williams evidence says Taiwan has performed a lot better. Then they say that the U.S. is leading vaccine research. There's no warrant in this evidence about why like Medicare for all would solve. Secondly, it's about stopping a pandemic after it's happened. We could stop the spread before we even need a vaccine in the first place. We outweigh because a recession is inherently short term. The 2008 recession happened, and then like literally global poverty was at an all-time low a few years later. However, like pandemics will continue into infinity until we stop them. Their recession is a one-time deal. Ours literally happens until infinity until we solve the problem. They say like their fourth piece of warranting is that recessions like make pandemics worse. There's basically no warrant in this. Our argument is that pandemics trigger recessions in the first place, which is a prerequisite argument and has to come first. We're winning the weighing. Also, we outweigh on probability because they've conceded the high D evidence, which says that a next pandemic is literally inevitable, whereas their case are all projections of what could happen under Medicare for all. Let's go to the neg. On the negatives in the Lopez turn, we're heading towards recession now because high healthcare costs are stifling consumer spending. They say that taxes would happen. Republicans hate taxes. The bill leaves the implementation of the bill up to Congress. It just gives suggestions for taxes. We say it's probably more likely we just deficit spend. At that point, the only way to save our economy from a recession is to increase consumer spending by decreasing like healthcare costs, which means that their recession is at least non-unique, but it's also a turn because it means we could literally save the economy because if consumer spending increases, then the stock market would also grow because our economy is doing better. The second thing you can extend is the Silverstein evidence that says that the companies would diversify into like health, IT, and global. They say like investors wouldn't diversify. The argument isn't about investors diversifying; it's about the like the healthcare companies themselves diversifying, which means they don't have any adequate responses. The ready evidence says that investors want them to diversify, but since these companies are so stubborn, they're not doing it in the status quo, which means the stock market literally goes up because there's more diversification in their world, which means we have a pretty clear link into stocks. Don't let them read new arguments. In second summary, it's too late.
Did you send Silverstein already? Okay, yeah, we did.
Did we? I can't remember.
Yeah, it's in the email chain. We'll start running prep now.
Okay, is everyone ready? It's going to be starting with their weighing, our weighing, their case, our case.
Wait, I even didn't hear that. Wait.
Their weighing, our weighing, their case, our case.
Right. Okay.
Starting with their weighing, they say three things. First, they say that recession is short-term, which means that that it doesn't even matter. That's not true. Recessions have super long-term impacts. For example, there's intergenerational poverty, which means you should be looking to that first. I'll get to the why time frame matters more later. But then second of all, they see the prerequisites because they say that they cause a recession with pandemics. That's not necessarily true, A. But B, we'd say that it's the culture of pandemics that's going to exist either way. Pandemics are going to happen either way. You can't just necessarily prevent them, so they don't actually do prerequisites. But then third of all, they say that they have probability. But no, we say that probability doesn't matter because the recession happens on day one. Investors flee the moment they see that Medicare for all passes and their stocks don't matter. But now let's go to our weighing. We're outweighed for three reasons. The first is time frame. Like I just said, investors flee on day one because they realize that the stocks don't matter anymore. The reason why this matters to the round is because of intervening actors. Intervening actors means that there's so many other things that could prevent pandemics from happening, or cause them to happen in the first place, like pandemic or like social distancing or hospital beds. But there's literally nothing that we can do to prevent the stock market from collapsing because investors, according to the Abelson evidence, will literally leave right away. That is the most important impact in the round because intervening actors controls the link to all the rest of the weighing. Because if you don't have intervening actors, that means that you should be looking to our weighing first. But then the second piece of weighing is the prereq that they also dropped. They dropped the Bozzoli evidence that indicates that during recessions, hospitals close down more and they have to restrict access. The reason why this is important is because in order to have a link into their case, they need to be able to detect the cases in hospitals in the first place. We're seeing that those hospitals don't exist. We prereq their argument. And third of all, we say that we short circuit their argument because of social distancing. We say that during recessions, because of the culture of the American economy, people tend to just go out and go to their jobs because they're out of desperation during a recession. That's exactly what happened during the COVID pandemic, which means that we ultimately are going to be short-circuiting because of a recession. With that, let's go to their case. Three major responses here. First of all, they say that management doesn't matter and that Trump is going to leave office soon. That's not the argument. The argument is that the culture of the American people is that they care more about recessions. So recession always comes first. Then on the Norquist turn, two things here. First of all, we say that hospital beds are going to be restricted under Medicare for all because you have to consolidate the system so much, which means that you can't even detect it in the first place. Then second of all, they don't address the turn. What we say is that there's loose regulation, which is causing innovation in the status quo. And that means that A, we can solve for the COVID pandemic right now, but B, you can have the vaccine. That's important because it turns their argument because we actually have solvency. Now go to our case. They extend this one response about diversification on our second contention. That's not true. Their evidence is literally terrible. Our argument is much better on this question because we say through the Abelson evidence that investors are going to be fleeing on day one. They're not ready to diversify on day one because the stocks would be literally worthless. At that point, extend case. Wolf explains that the economy is rebounding right now, but White explains that a next shot would push us into depression. However, the Abelson evidence is that the investors are going to leave immediately, and Epstein says that trillions would be drained from the economy, which ultimately leads to Bradford saying that 900 million people would go into poverty because the healthcare sector collapses. So the weighing of that is done. Now, quickly on our contention one, they talk about this turn about taxes, about the economy. They don't get access to this because the recession happens before that happens. And the reason why the recession matters is because their economic growth doesn't matter insofar as people don't spend during recessions. They save their money, which means that they don't get access to economic growth, which means that they can't solve for the recession. The recession is going to come first because of time frame, which frames the rest of the round. Vote neg.
We'll run some. All right, that was like 30 more, so I think we got like 45 left. All right, are you guys ready for cross?
Yep.
Okay, during a recession, does unemployment go up or down?
Up.
Okay, so your third argument that like during recessions, pandemics get worse because they go to work more, how does that make sense? If unemployment goes up, they would go to work less.
Yeah, but the people who are employed go to work so that they don't become unemployed. That's the argument.
Yeah, people go to their jobs in a functioning economy as well.
They go home to social distances. That's what happened with the COVID pandemic too. Like once the economy started doing so bad, people started to say, you know what, it's okay. Like I might as well sacrifice the small probability that I get COVID to me literally having a livelihood.
Also,
that's like
first, that's literally. That's okay. Your argument isn't true Like
Even-
people go to work in functioning economies as well. Like there's no evidence that people like increase their work hours or whatever.
But
People
that's not the
decrease their
argument.
work hours because less people had jobs, like
But
millions less people had jobs.
Yes, that's not the argument. The argument is that during pandemics, when you're required to social distance, people are more likely to go to their jobs during a recession because they want to
Okay.
have livelihoods intact.
They don't have a job though. They can't be more likely to go to their job if they don't have a job.
Some people
Gus,
won't have jobs, but they'll
Gus,
still go to like
the
grocery
US
Like
store.
millions of people, like 40% of the US population didn't have a job during coronavirus.
I would say that if 60% of people are still going to their job, that's enough to spread the
That's
virus.
non-unique because they go to their job no matter what.
Also non-responsive to the other part of the weighing is that we open up the economy during recessions,
Okay.
which is during like a recession and a pandemic at the same time.
Okay.
Question.
First, yeah, that's fine.
Okay. So let's talk about your solvency. You read just Williams that says Taiwan solved better, right?
Yeah.
So what policies other than single payer did Taiwan implement?
I don't know. Do you want to tell me?
Yeah, so they imposed let me do it's around equal to $1,000 if you were caught outside of your house.
Okay. So when
It's
was
obviously a different
first?
system.
Can you explain to me when you said this before Grand Crossfire?
I mean, I would just say your argument doesn't make sense for the
It's
U.S.
to-
Taiwan example.
It's to prove that the recession is inevitable. Or no,
Okay,
sorry.
again, when was this argument made before
No,
Grand Crossfire? Like, I understand what the implications of it are. I just want to know when it was said.
It's an explanation of the culture response that we say that it's a matter of the U.S. taking we knew that it was going to happen. It's
Okay.
a matter of the American people
Again,
reacting to it different. Yes,
our argument,
home,
this argument,
the US didn't.
this argument doesn't apply. We responded. First, Trump, like, is it possible to predict who's going to be in office? The second thing is that Trump is only opposed to nationwide lockdowns because, like, they hurt the economy. Our argument is that we do more targeted lockdowns so that the nationwide economy doesn't have to be shut down in the first
Okay,
place.
so you just said that. Okay, that's fine. You can get a question. It's fine.
Okay. So you say that like hospitals close because there's a recession, right? So in order for the recession to happen, the pandemic has to get really bad, right?
No.
No.
The recession is a link from our contention to about stock market, which happens on day one, and you never responded.
Okay.
to that.
Yeah,
That's fine. We'll run our remaining 45.
All right. Is everyone ready? Okay. It's going to be the AF, then the Wang, then the neg. Okay. Extend pandemics. The Heidi evidence finds the factory farms are the perfect place for pandemics to spread. The WHO literally says that a pandemic coming from these factory farms is inevitable. And the Zimmer evidence finds that Medicare for All tracking and centralization through better systems will identify pandemics before they can break out and go global. And the Williams evidence finds that Taiwan implemented these systems and has only had 7 coronavirus deaths. We can stop pandemics through centralization. And the Paramo evidence finds that each pandemic that happens in the United States without centralization will pull 100 million people into poverty. Let's go to the Wang. First, extend our time frame, Wang. Pandemics will continue to happen and trigger recessions continuously until we solve. Their recession only happens a single time and does not trigger and does not continue on indefinitely like the pandemics recessions were. All they say is that pandemics will exist either way. That's like saying Corona doesn't matter because HIV exists. For every pandemic you stop a massive recession. Then they say that recessions have long-term impacts. We link into recession. Then they say that there's also extend our probability analysis. Our evidence says that it's literally inevitable. However, all they say is that their recession happens on day one. It doesn't matter when it happens. No socialized country has gone into a recession after implementing UHC. It's super improbable. They say intervening actors, there's nothing to stop a crash. The government does bailouts and fiscal and monetary policies to save the economy. That's how 08 happens. On the prereq weighing, they say that like it hurts hospitals. That recession only happens once, and also the link isn't hospitals, it's testing. Then they say more people will go to work. That's very low solvency, and also people go to work less in a recession. On their responses, they say that management is the problem. They drop Gus's responses. First, we'd have no idea who the president will be, and second, it's not about a full lockdown. Public health officials are the ones who have control over finding hotspots. It's very small scale at first, which is why the federal government doesn't care about these small scale projects. And on Norquist, they're saying that they're better at stopping the pandemic after it's happened, but it's not about, but we are stop the pandemic before it happens, which means that their solvency only happens after millions have died. On their side, Silverstein finds that healthcare companies will diversify to international markets and health IT, and they just say that investors flee on day one. However, investors won't flee because they know that the company values will increase in the long term. Their recession is short term.
Your like last 3 sentences were over time, right? Like
It might have been the lag, but like that's what I had.
It was like 7 seconds over, yeah.
okay. We'll just go. Just say you extended Silverstein then. Is that fine?
Yeah.
Okay.
Okay, so it's gonna start on Wang, and then go to our Wang, quickly respond to their Wang, and then our case, their case, I think. Yeah. Does that work for everyone? They have conceded the meta Wang debate that comes from Arjun's summary. We explain that time frame controls the rest of the Wang debate because our argument is that on day one, right after Medicare for All gets passed, our impacts happen. You have no idea when this pandemic ever hits. You have no idea when all these growth impacts hit. You know for a fact on day one, right after Medicare for All passes, the stock market crashes and we go into recession, which means that you have to look to our Wang arguments first because they happen first and you have no idea when their impacts happen. Let's go to our Wang. The first argument that we make and extend through the round is the Bozzoli evidence that explain that hospitals close down during recession because they no longer have enough money. They respond first in first final focus. Number one, it's too late. But number two, our argument is that hospitals permanently close down. This short circuits their pandemics argument because you have to go to the hospital to get tested for pandemics, which means that if we go into recession on day one, right after, you can't solve back for the pandemic that's inevitably going to come. But number two, they drop the recession makes pandemics worse argument because we say when the economy is going down, people feel like they need to continue to work and make that money back so they don't go into poverty, which is why during a recession, the pandemics get far worse because they go to work. At that point, go to extensions. Their only response is essentially that companies are going to diversify. They never respond to the Abelson evidence that explains that you're taking out 20% of the GDP. The rest of it's conceded. The White evidence explains that the economy is recovering in the status quo, but another shock would push into a depression. The Abelson evidence explains that when you abolish private health insurance through Medicare for All, you would collapse the entire stock market in order to take out 20% of the GDP, which pushes 900 million people into poverty. I already did the Wang on the recession. Go to their case. On their pandemics argument, there's two big problems here. Number one, our argument is about the American people, not whether the president is bad. Our argument is that the American people don't believe in the social distancing, which is why people in like other states, for example, like in Alabama and these other red states, are still not social distancing, even if Trump did say so. But second, our argument from the Norquist evidence is not responded to until first final focus is way too late. Our argument is that loose regulations on innovation allows, number one, to solve back for the COVID pandemic the best, but number two, solve back for future pandemics. Even if they solve for one pandemic, we solve for all future impacts on pandemics, which means that we are the best solvency on pandemics on magnitude and time frame.
Good round.
Good round.